McCary, Johns Hopkins health policy expert and a Fox News contributor. He has results of a new study on natural immunity, which is a major issue when it comes to vaccine mandates. So this is a letter in the JAMA. You're an author of it. You put together a study here in which you looked at antibody prevalence among people who were in the study. What you found was that among 295 unvaccinated patients who tested positive for COVID, antibodies were present in 293 of them, or 99.3%. Do we know, though, what the clinical significance, Dr. McCary, is of this? Does it actually confer immunity?
We think it does, John. So one of the open discussions we've had with public health officials in the open forum for a long time is whether or not prior COVID infection, that is natural immunity, gives you a strong antibody response, and is it durable? And we found that those levels were very much at the neutralizing level. They were in the same range as that of vaccinated immunity, but they were more persistent. That is, they were constant and stayed at a constant level for up to 22 months, nearly 2 years. And that's simply because that is the time period in which COVID has been around for us to study it. It's not that it will fall off a cliff after 21 months. So this does answer an open question that we've had to date. And we also looked at its effectiveness against Omicron and found that natural immunity was 66% effective against Omicron. Compare that to vaccines. Vaccines are about 16% effective after the primary series and 35 to 45% with a booster.
So one of the big questions that you prompt is, what should we do about public health policy? The Hill said that the CDC is finally beginning to recognize natural immunity, saying, quote, "It's time to update vaccination policies and school or work entry requirements across federal and state or county governments. Not exempting those with prior infection was always unfair. Now it is unscientific as well." So added to the body of research that is out there, what does your study suggest about where we should be going with public policy when it comes to prior infection and conferred immunity?
Well, first of all, there have been over 40 major studies on natural immunity throughout the pandemic from Cleveland Clinic and many other institutions. This study simply affirms all of those results and does suggest that the duration is strong. Now, the CDC's own data shows that natural immunity is 3 times more protective than vaccinated immunity alone in preventing hospitalizations, and 5 times more protective against getting it. So ironically, when businesses fired those with natural immunity for not complying with the vaccine mandate, they fired those least likely to spread the infection at the workplace. They deserve an apology and they should be reinstated. And we need as a country now to recognize natural immunity and give credit towards immunity requirements like Israel and Europe. We should probably change the lexicon from the vaccinated and unvaccinated to the immune and non-immune to be more medically precise.
Doc, just got about 30 seconds left, but I wanted to ask you something else. And this, what's going on in Europe right now with the decline in Omicron infections, we're seeing a lot of European countries open back up again. Sweden is the latest to do it, as we reported just a few minutes ago. And I'm left to wonder, what's wrong with us?
Well, look, we've painted ourselves into a corner, and we've had now the CDC adjudicating on every aspect of American life, and people are highly dependent on that guidance. We need now to get to some common sense recommendations that apply to all respiratory pathogens. That is, if you've been exposed, wear a high quality mask for a while. If you're around someone vulnerable, stay your distance and be careful. And if you're sick, stay home. We need to get back to common sense practices that will apply for all respiratory pathogens in seasons in the future as well.
Sage advice, Dr. Marty McCary. As always, good to see you. Thanks for being with us tonight.